Welcome to the Brain People Podcast, a show where four mental health experts team up to bring you practical tools for overcoming mental health challenges. The Brain People don't replace your doctor or therapist, but we will give you some extra tools to help you on your journey. So join us as we fight mental illness, one episode at a time.
Welcome to the Brain People Podcast. We're doing things a little bit different this time. I have Jonathan here with me on Zoom because he's not with us, technically not with us. He's with us, but not with us. And you're listening to the Brain People Podcast, but we're separated.
Quite an introduction there, Amanda. I feel like after like 70 or so episodes, we be a little bit smoother at this point. But it's good to be here.
We're keeping it real.
Yes, I'm not. For those that are not watching the video, I am far away, about an hour away, actually, in a separate office space. But still with you guys with video and also in spirit and in heart as well. So we've got an exciting episode today, right, Amanda?
Yes, we do. This is something we've been wanting to talk about for some time now. And well, do you want to share why you wanted to talk about it?
I do.
Okay.
So the reason that I thought this would be an interesting topic was in part because it's come up so many times during my appointments that people were somewhat confused what my role was, whether or not I was a therapist, whether or not I did diagnosis, whether or not I gave them medication and so on and so forth. And so many times it can be somewhat confusing because navigating the world of mental health and all the different roles that various clinicians might play is somewhat like alphabet soup. It can be extremely confusing, even sometimes for those that are in mental health.
Yes.
For those that are in mental health, but let alone for those patients, that are trying to figure out where they're supposed to go. And so we thought that this topic might be useful for somebody that is maybe earlier on in their mental health journey, or even those that maybe are somewhat seasoned, to try to get a better understanding about what the different roles what the different roles are and who might be most applicable for your particular situation.
Yeah, and the reason I wanted to talk about this as we were talking about this was that I often hear my office is right across from receptionist. Well, it used to be. And then now I hear the triage person. That's not their official title, but that's what I call them. Field calls from people. And I often hear those people say, well, what do I need? I just need help, but I don't know who I'm supposed to talk to. And then when we often refer them to somebody, then we hear them say, well, who's that? What do they do? Do I need medication? Do I not? And so this is our way of helping people understand and navigate the world of mental health a little bit easier.
Very true. So we've broken this down into a few different categories. Do you want to tell us what those categories are, Amanda?
Yes. So we have licensed and non-licensed. We have prescribers and non-prescribers. And so you can have licensed non-prescribers and licensed prescribers, and you can have non-licensed. Now I'm confusing myself. See, we told you this is even confusing for us.
Well, let me help you out there. So any prescriber is going to be licensed, right?
Yes.
But of the non-prescribers, you can have a license or you may not.
Yes.
And this doesn't mean that just because you don't have a license that your role isn't particularly important. But in terms of the prescribers, I'll take over primarily that particular
And real
conversation.
quick first, What does a prescriber mean? It means they prescribe medication. So that's important to know too.
Essentially, yes. That's one of the primary roles and one of the most distinguishing things that we do in contrast to what most of the other roles that we'll talk about. So there really are three, we'll just break it down into three sort of licenses, if you will, amongst the prescribers. And so the first is going to be a physician. Now, A physician that specializes in mental health is called a psychiatrist. Many people often think psychiatrists are different than physicians. They're really not. They went to medical school. They have an MD or a DO licensure. They just did a mental health residency in order to become a psychiatrist. So all of you guys are familiar with Dr. Binus if you've been listening to this show for more than one episode. So he is our in-house psychiatrist. Any questions about that, Amanda?
Well, yeah, so I'll pretend that I'm somebody that doesn't know too much about all of this. So what does a psychiatrist do besides just give out medications or prescribe medications?
So like most physicians, if you go to your general practitioner, if you go to an urgent care, there's going to be some assessment, right? And so most doctors' offices, including psychiatrists, will usually take people's vitals. Right? They might, they'll likely weigh them. They'll likely have them answer a number of questionnaires right before they even see them for that first visit. And that'll give them some additional information, both regarding their physical health history, but also their mental health history. And then they'll use that information in conjunction with like the DSM criteria, which is the Diagnostic Statistical Manual, excuse me.
We almost never say that full name. We just say DSM.
So we use that in conjunction with clinical knowledge and in conjunction with various questionnaires and history in order to make hopefully an accurate assessment of the patient's mental health diagnosis. And then usually there'll be an offering of various sort of treatments. So hence the name prescribers. Oftentimes it is going to be a prescription medication that will be included in the treatment plan. But there are other things that we can do in addition to just medication. So
what are those things, Jonathan?
So some psychiatrists will offer psychotherapy. That is becoming less and less common, primarily, my understanding, due to just reimbursement rates and the insurance sort of infrastructure, if you will. So that's one other option. Sometimes we can make referrals to other treatments like TMS or ECT. We can also, offer guidance on, proper supplementation and how that might interact with, medical conditions and or other medications that people are taking. So
some will do even lifestyle recommendations too, in addition to that, if you get a good one.
Yeah, I know. Myself and Dr. Binus and the other clinicians at Beautiful Minds, we definitely prioritize a lot of the lifestyle intervention as well. And then another just real quick thing, we do often order labs just because a lot of the medications and even certain mental health diagnoses can be associated with abnormal lab work. And so that's another thing that we like to see. So that kind of describes in general what a psychiatrist might do.
So speaking of yourself,
yes.
I know this is where you're going, so I'm going to ask the question. So psychiatrists aren't the only ones who prescribe, and you are not a psychiatrist.
This is true.
So what are the other roles or positions that also are able to do some of those same things or not do all of the same things but are similar in their prescribing? I know your
a PA
licensure is included in that.
Yep. So the two other licenses, aside from MD and DO, which would both be considered, doctorate medical doctors, right, are going to be nurse practitioners and physician associates, also known as physician assistants. So in psychiatry, we will often refer to ourselves as I often do, a psychiatric PA, or a nurse practitioner might refer to themselves as I think it's a psychiatric
nurse practitioner,
mental health nurse practitioner.
NP.
because they have a really long acronym, PMHNP, I think is what they use. And so the similarities between a psychiatric nurse practitioner and a psychiatric PA, there's a lot, in terms of the length of training. It is quite similar. We do not have a doctorate degree. In most cases, unless you're a DNP, but in most cases, we're going to have a master's level. And so it's kind of like we go to a mini medical school of sorts. We get a lot of similar training in just a more condensed fashion, but we are, allowed to basically do, at least in the capacities that I've worked, do essentially everything that the psychiatrist is allowed to do as well. So we can do the assessment, we can do the lab ordering, we can do the diagnosis, we can do the various forms of treatment as well.
Yeah. Okay. So is there anything else in that prescriber level or that prescriber status besides PAs, NPs, and psychiatrists or medical doctors?
I guess there is a very rare psychiatric pharmacist. And so I've never met one, but I've heard that they exist. I know that there are some schools that are at least trying to sell, pharmacists on this idea. I don't know how viable it is and how many states kind of accept this role, and how many clinics are even willing to hire this type of provider. So they exist out there apparently, but like I said, I've
Maybe
never
if you are
met
one, you can comment or something.
Yeah, maybe
Correct us.
I'd love to hear a little bit more about them and how they're kind of fitting into this vast network of various mental health clinicians.
Mm-hmm. So, Jonathan, why don't you tell us, since we've been talking about the prescriber category, what would be the typical patient you would see? What would the scenario be that person would come in with?
Really, anybody with a mental health diagnosis or anybody that suspects that they are dealing with a major mental health issue, whether that be a acute or chronic issue. Now, a lot of the patients that are coming in and seeing us in a mental health clinic are going to be referred by their primary care doctor, or maybe even recommended to come see us by their therapist. Right? So maybe they don't really have an interest in seeing a psychiatrist or an NP or PA initially, but they go to a therapist. They're maybe not making progress, or the therapist recognizes that their symptoms are far more severe than what they can handle by themselves, and so they're making that recommendation that they might go. And so, in terms of the various kind of mental health diagnoses that we see, depends on the clinic in terms of the percentage of these particular diagnoses. But at Beautiful Minds Medical, for example, saw a lot of major depression and other sort of various types of depressive illnesses. We saw a lot of different anxiety disorders, such like panic disorder and generalized anxiety. We also worked with many patients that had bipolar disorder, ADHD, various personality disorders like borderline personality. And then we had some kind of higher acuity patients, a few sort of psychotic illnesses as well sprinkled in there. But that's the majority of, and then I guess I should also throw in there a lot of sleep disorder stuff as well, which tends to be comorbid with many of the other conditions.
Depression, anxiety, right? And things like that, yeah.
So those are the primary conditions that you're going to see in at least an outpatient kind of commercial setting.
Okay. Awesome. Did we leave anything out? It sounds like we talked about what you do, who you see, even background and education a bit.
Yeah, I think that's probably sufficient for our listeners. Basically the general takeaway with prescribers is that, as the name implies, you're usually going there, and in many cases, if symptoms are severe enough, you'll at least be offered some sort of prescription, right? And so the one thing that I want our listeners to hear is that just because you're offered it doesn't necessarily mean that you have to take it, right? Or doesn't necessarily mean that you can't get a second opinion. And if you do get multiple opinions and they're all, of a sort of a similar similar recommendation, then that's probably a good indication that maybe it's something to consider. But it could be, very different types of treatment modalities that you are actually recommended. Like I said before, Beautiful Minds, we often would talk about various lifestyle recommendations. We might suggest transcranial magnetic stimulation. We might suggest group counseling. We might suggest supplementation. And we might suggest medication and so on and so forth, right? So various different things that we could take a look at.
I just thought of another question as you were talking about that, because I think sometimes people are confused about this too. How much time should a patient expect to spend with you in their visit?
That can vary wildly in my experience. I think it's going to depend more on the clinic than the clinician per se, because of the expectations that are imposed, by the organization on the clinician, the prescriber themselves. And so at Beautiful Minds, myself and I know our other NPs and PAs, we would spend that initial visit, we'd spend 90 minutes with a patient, which is fairly rare in my understanding. And then usually follow-ups would be typically a half an hour. Now, with other clinics that I'm familiar with, many of them will do anywhere between typically 30 to 60 minutes is usually what I see for that initial appointment. And then anywhere between, I've seen as low as like 10 minutes and 30 minutes tends to be kind of the average for the follow-up visits. So usually if you're just seeing the prescriber for 10, 15 minutes, really you don't have any additional time to talk about anything other than the prescriptions that they're giving you. And so in those
symptoms or side effects and that sort of thing.
Symptoms, side effects, and essentially, right? So usually all related to kind of the treatment response, if you will, and what sort of adjustments need to be made from that. If you're allowed more time, then that's typically where you might get a little bit of like brief psychotherapies and lifestyle recommendations incorporated into the appointment time. But like I said, oftentimes that's going to be kind of fewer and farther between, at least in my kind of experience.
Yeah, I think that's about accurate from what I hear too. Yeah, sometimes 15 minutes is the average. At least some of my clients tell me that they spend with their psychiatrist or NP or PA.
Yeah. So switching gears, let's go to licensed non-prescribers. So,
okay.
And this would include things like psychologists and therapists. This is great to have you kind of explain this as a therapist for us, because so many people just say therapist or counselor. Right? And that is such a generalized term that includes a lot of different licenses. So why don't you break that down for us?
Okay, so, let me start with, the non-licensed ones, because I can go through that pretty briefly.
Okay.
There are people like pastors, there's peer counselors, maybe drug counselors, where they might have a certification. Pastors don't necessarily have to have a certification, though, because they're pastors. Even lawyers can give advice and counsel people by the nature of their job. But when you get somebody who is, say, like a peer counselor, usually they're doing something very specific. They're helping people that are of a certain age, like maybe of the geriatric 65 and over population.
Or grief.
And they're just, or grief counselors or drug counselors. And typically a drug counselor will have a certification too that they go through. It's not licensure with all the education and everything behind it, usually of years, but it's a program, maybe a week, not 1 week, but several weeks that they go through of certification. And that also includes even life coaching. So there are life coaches, and those life coaches, typically, they're helping you accomplish a goal that you've already decided that you want to accomplish. So maybe you're having a hard time getting out there and getting a job. like going through the interview process, looking for jobs. And that life coach would be the person that would help encourage you, help keep you on track, that sort of thing, to get that specific goal that you have in mind. Or with drug counseling to overcome substance abuse issues or something like that. So they're very specific with those. And they're usually oh, go ahead.
I did want to mention regarding the life coaching, we actually have done a few different episodes, I think 3 in total, with different life coaches. Episode 4 and episode 76 are 2 of the episodes that we've done with different life coaches. So if you're interested in kind of hearing their stories and how they manage their clients, and help them and with their life goals, and you can go ahead and refer back to those particular episodes. But carry on, Amanda.
And they typically work with individuals only. So it's, one person, one goal, and that's what we're focused on. So that's what the non-licensed providers help with.
And so how about our licensed non-prescribers?
Okay, so non-prescribers licensed would be like your social workers. Those are typically people who, social workers and therapists both have master's degrees, so they go through a master's program beyond college, and then they're also licensed in that, so we have to do testing and everything. Social workers typically focus on issues that happen in the community. Maybe they work at a clinic and they can work with certain demographics of people, maybe low socioeconomic groups. They can also do drug counseling or work in hospitals and that sort of thing. And they typically focus on triaging people in terms of, so you have this issue, this is a resource that can help you with that. And they help people introduce them to those resources and make sure they're following up with those. Social workers do also often nowadays do therapy. It wasn't so much the case when I was going to school. It was very distinct therapists or LMFTs, licensed marriage and family therapist, or now another term is LPC, licensed professional counselor, LPCC. They tended to be very different, where you'd have social workers only did this, therapists or counselors only did this. But now it's kind of overlapping. I think probably because of the demand, there are so many people that are needing these resources that now if I'm only limited to one type of treatment, then, well, what if I can only find this person to do it? Then so it's kind of overlapping, and it's a little blurrier now than it used to be when I first started. But social workers typically are individual focused and community resource focused.
And
but they also do the.
I know you mentioned community clinics is where you often will find a lot of social workers, and hospitals too, right?
Yes,
hospitals tend to employ a lot of social workers as well.
Yeah, and they might spend, say, 15 minutes with somebody following up they might be short term, especially if they're in the hospital, because people don't tend to be in the hospital long term. So it's kind of a revolving door more so with that. So that's probably a good description of social workers. Now you have therapists, which is the category that I would fall into, and I'm a licensed marriage and family therapist, and we're trained same master's degree and everything. We also have to go through the licensing process. So typically you have to amass so many hours of, I don't want to call it practice, but time where you're not licensed, so that you have that under your belt before you go through the licensing process. And then therapists or licensed marriage and family therapists, we typically deal with individuals just like everyone else, but we also do couples, families, parent-child relationships. We do also work with certain specific diagnoses like depression, anxiety, even all of the diagnoses that, say, you or an NP or a psychiatrist would work with, but we're not prescribing. We're often doing secondary work with them in terms of, now that I have my medication, I still need to work on my relationships and how this depression has affected my relationships and how I can help those relationships better. So licensed marriage and family therapists tend to be very much relationship focused. So everything comes down to, well, how does this depression, how does this anxiety, how does this bipolar affect my relationships at work and my family and anywhere else that I might go, and how I might interact. But we're not solely stuck to that either.
Sure.
So again, it's a little murky sometimes. Therapists and social workers can do groups, so we can work with people in groups. Say like a social worker could do a drug counseling group as well, or a marriage and family therapist could do a depression and anxiety group or something like that. So we can also do groups. And then psychologists, we'll go to that one next. So that is a doctorate degree, but it's not a medical doctor. It's like a PhD or a PsyD degree. And psychologists, they can do pretty much all of the things that I've already described. They can work in hospitals as well. They can often work in schools. They might do IEPs, like individual education plans. They tend to do more testing. They can also do research and that sort of thing. But if somebody is looking, say our audience, somebody's looking who they might go see, if they're going to see a psychologist, that psychologist isn't necessarily going to be doing testing and research in the way that they would do more therapy in a clinical setting or a therapy setting. But they can do the testing. They can do psychological testing. Therapists and social workers can also do that too, but usually there's extra training that you go through or certification that you do to do that as well. But I tend to find psychologists, they can be in private practice, but they're also in hospitals, in schools. There are a lot of school psychologists who do individual education plans. So if you have a child who needs, extra help academically or behaviorally in the schools, you'll have a school psychologist who will do testing to see what kind of needs that child has, and then triage them to the resources that they need, or work out the resources that child would need to do successfully in school.
So say I'm a patient looking for a diagnosis, right? And I'm looking in my general area, and I see, there's an LMFT or an LPC, available to go see. Can that therapist, can they give me a mental health diagnosis?
Absolutely. We can evaluate, we can assess, we can give diagnoses. We can do all of those things. We use the DSM. We actually have to give a diagnosis when somebody comes in, or else the insurance won't pay us. So we don't need somebody else to do that. We do that definitely.
So functionally, in an outpatient clinic though, because we have quite a few different therapists or types of therapists at Beautiful Minds, right? You're an LMFT. Obviously Katie is a psychologist. We have another therapist. She's an LCSW. So is there going to be a difference really between, and I'm not just talking about the three of you guys, but if you go to a clinic and there's you see multiple different names, multiple different letters after people's names, should you choose one over the other in the vast majority of circumstances?
That's actually a really good question, because in that case, it wouldn't be so much what their degree is or what the letters after their name would be. It would be more, what do they tend to be an expert at? So like some people, they tend to focus more on depression and anxiety because those tend to be worked through with cognitive behavioral therapy for the most part.
Yeah.
Or maybe that person is an expert in trauma and they like to work with trauma situations or people with trauma backgrounds, like say PTSD or something like that. And so the best thing to do is not just look for what degree that person has, look for their background, what kind of things that they tend to work in, what's their experience, and that might be a better, and that's usually how we triage people here is we look for, okay, who works with what, and you can even go onto websites like say psychologytoday.com, you can type in your zip code and you can type in any of the issues that you're dealing with, and then down will pop a list of all the psychologists, therapists, social workers in your area who deal with those issues, who take your insurance and that sort of thing. So it typically is more so, what's that person's background and what do they typically work with versus just what is their education background? Because I can tell you those of us that I work with, we all have areas that we tend to go towards or work more with, different expertises. And so when somebody comes in, we know, oh, that person would work well with this provider or prescriber, that sort of thing.
Sure. So one thing I was going to add to what you were saying was you may not have significant availability, at least in terms of the types of therapists. In our general area, it's very difficult to even find one to begin with, especially if you're trying to find somebody in person. So ultimately, the licensure of the therapist may not matter so much as just being able to get an appointment, being able to get yourself in front of somebody. Now, ultimately, if you do have lots of different options, trying to seek out a particular, in the vast majority of cases, if you're dealing with depression, anxiety, even sleep issues, because I know a lot of therapists will do like cognitive behavioral therapy for insomnia, or maybe you're dealing with family issues or trauma history, things of that nature. Most of the different types of therapists are going to feel generally comfortable managing those things. What are some more kind of specialized circumstances where you think, just as a general rule of thumb, somebody might be more inclined to be a better fit with a particular type of therapist or counselor?
Well, if it's not just therapist or counselor, I would think that if somebody is, almost in a more desperate space, they're like, I'm not sleeping. A therapist might be great to get in with, but you might need that medication aspect to get you to where you can even pay attention to an hour-long therapy session because you're so sleep deprived. So one of the things is you may not want to be, especially like say with a clinic like ours or a practice like ours, you may not want to go in there telling people what you think you need, but be willing to accept what, that practice suggests that you might need. And then you could go to somebody afterwards once you get the initial need met. It doesn't mean, oh, now that I'm seeing a psychiatrist, I can't see a therapist, and I'm seeing a therapist, I need medication. Why won't they let me go see a psychiatrist? You can actually do all of those at the same time. You can have a psychiatrist and then have a therapist as well.
How about this? Can you have multiple therapists at the same time?
No, well, I won't say you can't, but I will say it's not a good idea. And
Okay.
it's not because we're all going to give you different things to do. It's one, we have like if you want to call it a gentleman's, a respect. It's a respect within the practice of therapy that we don't step on each other's toes. We're
Gotcha.
not, and you might have, if you try to have two therapists, you might have two different therapists getting you to the same place, but in different ways, and that might be very confusing to try to follow both, even though they're trying to get you to the same place. If they don't know that the other one exists, you might be really confused because, wait, this one said this and this one said that, even though they're getting you to the same place in the end.
If you're doing, say, couples counseling with one therapist and then individuals counseling with a different therapist, like, do you think does that like go against the code of ethics between therapists?
No, it doesn't. It doesn't go against the code of ethics, though. But your therapist may want to have access to talking to the other therapist. Sometimes that happens where we sign forms that, or you sign forms as the patient or the client that says, I'm okay with this therapist talking to this therapist, or this psychiatrist talking to this therapist, or vice versa.
Very cool. Any other licenses that we didn't discuss under the non-prescribers, the licensed non-prescribers? So, if I let me kind of remind our audience of some of what you said. There's clinical psychologists, so this would be a PhD or PsyD. Now, my understanding between those two is the PhD tends to be a little bit more academia, research oriented, whereas the PsyD tends to be more clinically oriented. So
That would probably be the case, yeah.
and I know there's definitely going to be some overlap, and it's going to be individual basis, but that may be sort of overgeneralization. And then between the different counselors or therapists, we've got LMFT, we've got LPCC, we've got LCSWs, and a myriad of others depending on the state that you live in.
Yeah,
right?
States will definitely change what you might have the same thing from one state to the next, but they're called totally different things.
But in terms of those different licensures, functionally, they're all going to be fairly similar if you're dealing with the most common types of mental health conditions, right? I would imagine that with very, very more rare, say you have an extreme form of, say, OCD, or you have kind of a unique maybe psychotic disorder or personality disorder that's just not as common. The individual therapist that specializes in that particular thing is going to matter more than whatever license they have, right?
Yes, it's definitely going to matter more. And there are some places, we are talking about individual prescribers and providers, but there are some places that, you go there and it's a whole team of people, from social workers to therapists to psychiatrists, who specifically focus on, say, OCD or eating disorders or something like that. So that is also an option. And then okay, these people, this is pretty much all they do. They might deal with the depression that comes from the eating disorder or the OCD, but they're specifically focusing on that diagnosis that is very unique to me.
Yeah, that's a good point. I know in the Sacramento area, just because of the how large this area is, there's a few of those particular clinics that specialize in very distinct types of mental health disorders, which is just
and
go ahead.
Yeah, you'll find those more in the metropolitan areas versus little out in the country practices, or in even more rural area or urban areas and stuff like that.
I did just realize that we didn't talk about one licensure, and that would actually be a psychiatric nurse. So this would not be nurse practitioner. So a nurse practitioner can prescribe, as we discussed earlier, but a psychiatric nurse is going to be a registered nurse or an RN. Typically, they will have either like an associate's and certification or bachelor's degree working in psychiatry. Now, generally speaking, they do a variety of different things. They can administer medication, right? So they might do injections, or they might have oral meds that they're handing to you, but they themselves are not prescribing those medications. They are following the orders of the prescriber. And so, at least at the clinic that I'm now working at, our nurses actually do everything from sort of functioning as our receptionist and scheduling our appointments, to also doing our injections, to communicating with the pharmacy as well, to make sure patients are getting their prior authorizations completed and getting the medication, and so on and so forth. So they definitely can be a very crucial part of the team itself.
Yep, we have those at Beautiful Minds too.
So anything that we missed? I mean, we probably missed a few things, but
yes, we don't have time to do everything, I'm sure. But I think those are the main things. I think that's a good way of helping people understand what to expect from their, interactment with a mental health facility. And so, but don't get scared if you feel like you heard way too much and, that's a lot to take in. Just realize that within each practice, you can ask questions and the people who are providers can also explain more to you if you're unsure or you think you need something that you're not getting. Be an advocate for yourself too and ask questions. If the person who's working with you is unwilling to answer questions, that's not a good thing. They should be open to answering any of your questions because we all understand that this isn't everybody's, it is sometimes their first time and you just don't know, and that's okay.
Yeah, I like what you just said there about being an advocate for yourself. And it's hard to be an advocate if you're not properly informed, right? It's hard to know what you need if you don't really have the knowledge about what various options are out there for you. And so we hope that, in discussing some of the various types of mental health professionals that you might encounter along your mental health journey, that it might give you an idea of just their various roles and whether or not they might be appropriate for your particular situation that you're currently in, or maybe a future situation that you might be in. Because at some point, maybe you didn't know that a health and wellness coach or a grief counselor really existed, right? You didn't know that these were services that were potentially available to you. And so if you don't have that knowledge, then if those issues were to come up at some point in the future and you feel like that could be a good fit for you, then you wouldn't necessarily seek it out. So we are hopeful that some of you listeners might be able to take some actionable steps to make sure that you're getting the proper care that you need and advocating for yourself in the best possible way.
Yeah, thank you for joining me, Jonathan, even though you're kind of far away. You're still here.
Yeah, it's good to see you. And thank you all for joining us for this conversation. We hope that you got some useful tidbits of information out of it. And we look forward to seeing you again next time. Thanks for listening. If you enjoyed today's episode, please like and subscribe. Your engagement will help us reach more people who need encouragement. To hear more episodes, learn about our other mental health resources, or support us financially, visit thebrainpeoplepodcast.com.